Rajiv, what will we be discussing today?
We'll discuss electrolytes in our body.
What are electrolytes? Where are they present?
See, electrolytes are naturally occurring elements and compounds in the blood and body.
What is the role of electrolytes in our body?
They control important physiologic functions.
What are the elements and compounds of electrolytes that are present in the body and blood?
In our blood, electrolytes present are potassium, sodium, magnesium, phosphate, chlorides, and calcium. These substances are present in blood, bodily fluid, and urine. They are also ingested with food, drinks, and supplements.
Is any disorder caused by an imbalance of electrolytes?
See, electrolytes needs to be maintained in an even balance for body to function properly. Otherwise, vital body systems can be affected.
So there are problems caused by an imbalance of blood electrolytes?
Severe electrolyte imbalances can cause serious problems like coma and cardiac arrest.
What are the symptoms?
Mild forms of electrolyte disorders may not cause any symptoms. Such disorders can go undetected until they are discovered during a routine blood test. Symptoms usually start to appear once a particular disorder becomes more severe. Not all electrolytes imbalances cause the same symptoms, but many share similar symptoms. Common symptoms of electrolyte disorders include irregular heartbeat, fast heartbeat rate, lethargy, diarrhea or constipation, nausea and vomiting, convulsions or seizures, abdominal cramping, muscle weakness and cramping, irritability and confusion, headache cases, numbness and tingling. Electrolyte disbalance can become life-threatening if left untreated.
What are the causes of electrolyte disorders?
Electrolyte disorders are most often caused by a loss of bodily fluids through prolonged vomiting, diarrhea or sweating. They may also develop due to fluid loss related to burns. Certain medications can cause electrolyte disorders as well.
What are the other types?
Elevated levels of electrolytes are indicated as prefix hyper. Depleted levels of an electrolyte are indicated with hypo.
Can we discuss potassium, sodium, calcium, chloride, magnesium, and phosphate?
Yes, why not? See, potassium is particularly important for regulating heart function. It also helps maintain healthy nerves and muscles. Due to high levels of potassium, conditions can be fatal if left undiagnosed and untreated. It's typically triggered by severe dehydration, kidney failure, severe acidosis, including diabetic ketoacidosis. Certain medications, including some blood pressure medications and diuretics. Adrenal insufficiency, which is when cortisol levels are too low. When potassium levels are too low, it often happens as a result of eating disorders, severe vomiting or diarrhea, dehydration, certain medications including laxatives, diuretics or corticosteroids. Sodium is needed in the body to maintain fluid balance and is critical for normal body function. It also helps to regulate nerve function and muscle contraction. When there is too much sodium in the blood, it may occur due to inadequate water consumption, severe dehydration, excessive loss of bodily fluids as a result of prolonged vomiting, diarrhea, sweating, or respiratory illness. Certain medications, including corticosteroids, when there is too little sodium, it causes due to excessive fluid loss through the skin from sweating or burns, vomiting or diarrhea, poor nutrition, alcohol use disorder, overhydration, thyroid, hypothalamic or adrenal disorders, liver, heart or kidney failure, certain medications including diuretics and seizure medications, syndrome of inappropriate secretion of antidiuretic hormone. Calcium is a vital mineral that body uses to stabilize blood pressure and control skeletal muscle contraction. It is also used to build strong bones and teeth. When you have too much calcium in the blood, this usually happens to hyperparathyroidism, kidney disease, thyroid disorders, lung diseases such as tuberculosis or sarcoidosis, certain types of cancer including lungs and breast cancers, excessive use of antacids and calcium or vitamin D supplements, medications like lithium, theophylline or certain water pills. Lack of adequate calcium in the bloodstream can cause kidney failure, hypoparathyroidism, vitamin D deficiency, pancreatitis, prostate cancer, malabsorption, certain medication including heparin, osteoporosis medicines and antipyretic drugs. Chloride is necessary for maintaining the proper balance of bodily fluids. When there is too much chloride in the body, this can happen as a result of severe dehydration, kidney failure, dialysis. When there is too little chloride in the body, this is often caused by sodium or potassium problems. Another causes can include cystic fibrosis, eating disorders such as anorexia, scorpion stings, acute kidney injury. Magnesium is a crucial mineral that regulates many important functions such as muscle contraction, heart rhythm, nerve function. Excess amount of magnesium is a disorder that primarily affects people with Addison's disease or end-stage kidney disease. Too little magnesium in the body. Main causes are alcohol use disorders, malnutrition, malabsorption, chronic diarrhea, excessive sweating, heart failure, certain medications including some diuretics and antibiotics. Another electrolyte, phosphate. The kidney, bones and intestine works to balance phosphate levels in the body. Phosphate is necessary for a wide variety of functions and interacts closely with calcium. Hyperphosphatemia can occur due to low calcium levels, chronic kidney disease, severe breathing difficulties, underactive parathyroid glands, severe muscle injury, tumor lysis syndrome, a result of cancer treatment, excessive use of phosphate containing laxative. Low levels of phosphate can be seen in acute alcohol abuse, severe burns, starvation, vitamin D deficiency, overactive parathyroid glands, certain medication use such as intravenous iron treatment, niacin and some antacids. Diagnosing a simple blood test can measure the levels of electrolytes in your body. Hypernatremia can cause loss of elasticity in the skin due to significant dehydration. Both increased and depleted levels of some electrolytes can affect reflexes.
What are the risk factors that can cause a electrolyte disorder?
Conditions that increase risk for an electrolyte disorder include alcohol use disorder, cirrhosis, congestive heart failure, kidney disease, eating disorders such as anorexia and bulimia, trauma such as severe burns or broken bones, thyroid and parathyroid disorders, adrenal gland disorders.
Do you have any tips to help us prevent an electrolyte disorder?
Visit a doctor if you are experiencing common symptoms of electrolyte disorders from above mentioned. If the electrolyte disorder is caused by medications or underlying conditions, your doctor will adjust your medication and treat the cause. This will help prevent future electrolyte imbalances. Stay hydrated if you are experiencing prolonged vomiting, diarrhea or sweating. That's all.
Thank you very much, Rajiv. I appreciate this information about electrolytes, and I hope that everyone will be able to learn more to keep a proper balance of electrolytes in their body.
My pleasure. Thank you.
Thank you.